We might kick off. Welcome, everyone. Thank you so much for joining us tonight for our Inner Melbourne Priority Primary Care Centre information session. My name is Bianca Bell. I'm the Executive Director of Acting Executive Director of Health Systems Integration at the Northwestern Melbourne Primary Health Network. And I will just start by sharing my screen. And just check that everyone can see that okay.
Yes, we can.
Yep. Got the slideshow up there, Mel?
Yes, definitely.
Excellent. Sorry, it always comes up on different screens.
Yes, yeah.
So just before we start, I would like to acknowledge the traditional custodians of the land on which our work takes place, the Wurundjeri Wurrung people, the Bun Wurrung people, and the Wathaurong people, and pay respects to elders past, present, and emerging. So I've introduced myself, but I would also like to introduce you all to Abby Howe, who's joining us from the Victorian Department of Health. Abby is the Director of Primary Care System Improvement, also joined by her team member, Bryony, as well from the department. We also have Melanie Mendoka on the line. Mel is our procurement director at Northwest Melbourne Primary Health Network. So she's going to talk us through a little bit about the tender link process that you probably have all registered for. And then we'll have some time for questions and close. So really the agenda for the session is to run through a bit of an introduction of priority primary care centres, which Abby will take us through. Mel will then take us through that procurement process, as I spoke about, and some key timelines and milestones to make sure that everyone's aware of that. And then we'll have time for questions. So if you do have questions, please, you can use the chat function, or please raise your hand and we can take your question there. So we will kick off. Abby, I am happy to share your slides if you just want to let me know when you want me to move on.
Thank you. Thanks, Bianca. I would also like to begin by acknowledging the traditional custodians of the lands on which we're meeting and pay respects to elders past, present and emerging. As Bianca mentioned, my name is Abby Howe and I'm the Director of the Primary Care System Improvement team in the department, and we've been responsible for rolling out the new priority primary care centres over the last at least 12 months or so. So Bianca, if you're happy to go to the next slide. The Victorian government is establishing 28 new GP-led priority care centres, and we commenced working with PHNs last year to roll out these clinics. A key aim of the priority primary care centres is to help reduce pressure on emergency departments and obviously support people to access urgent care closer to home. So they're a very exciting initiative for the Victorian government to be involved in, and it's been a really positive partnership with the primary health networks. We have 24 PPCCs that are now operational, and several more to follow, including the Inner Melbourne site, which we're here to talk about tonight. So I guess it's really important to note that the purpose of the PPCC is to provide short-term care for people with urgent conditions, and then refer patients back to their existing GP or support them to identify a GP for their ongoing care. Recently there was an announcement around the Commonwealth entering into a partnership with Victoria to support our priority primary care centres. The Commonwealth is rolling out Medicare urgent care centres as well nationally. So we're really excited that as part of that Commonwealth initiative, they are partnering with Victoria in the delivery of 10 of our priority primary care centres, including the centre in Inner Melbourne. Next slide, please, Bianca. As I mentioned, a really important aim of the priority primary care centres is to help alleviate pressure on our hospital emergency departments, and we'll talk through a bit later in this presentation around the sort of governance and the working relationship, the working groups that have been set up between the local PPCC and the health service. The partnership between the PPCC and the health service is a really important part of the model, and the development of those bi-directional referral pathways and linkages, which really help reduce the pressure on the hospital. So we are really cognizant, I guess, of other models, and when we developed the PPCC model here in Victoria, we really did a fairly thorough scan of other models that operate both around Australia but also in New Zealand, as you can see on the slide, and that helped inform the model that we've developed here in Victoria. Next slide, please, Bianca. So the model incorporates some key elements which are outlined in this slide. I won't go through all of them, except to say that there's a really important emphasis on being open after hours, obviously, in order to be an effective model in helping to reduce demand on our hospitals and emergency departments. The centres need to be open in the after hours period. Ancillary services, access to pathology and imaging after hours is also an important part of the model, whether that's on site or whether it's just, you know, close by and accessible, is flexible, but it is an important part of the model. It's the centres are free for people with or without a Medicare card, so there's no out-of-pocket costs to patients. I think there's some of the key points around the model. Next slide. So in Victoria, we have PPCCs operating across both metropolitan Melbourne, and in that sense, that's both inner and outer metropolitan, as well as regional Victoria. Recently, we've had 2 GP respiratory clinics which have transitioned to become a PPCC, in that they've expanded their scope of services. So that includes the Monash Children's PPCC, but also Warrnambool GPRC is in the process of expanding its scope of services to become a PPCC. Then with the clinic to be established in Inner Melbourne, we'll end up with 28 PPCCs operating across the state, which is really a fantastic result in terms of getting coverage and expanding the access to primary care, and helping achieve those objectives around reducing demand on our acute system. Next slide, please, Bianca. Thank you. So this slide talks about the governance structure that we have in place to oversee the PPCCs, and I should say that this will be relevant but for the PPCCs that are both co-badged with the Commonwealth as well as the existing state PPCCs. We have a project advisory group which is advising on the implementation of the model. Northwest Melbourne PHN is the coordinating lead for the rollout of our PPCCs, and I'm not sure if I have already mentioned that. I think I did at the start, that the relationship with the PHNs is a really important one, because we do obviously commission the clinics through the PHNs. So we're really pleased that Northwest Melbourne PHN has that coordinating lead. They facilitate a community of practice, which is a really important forum for the operators of the PPCCs to come together and share information about the experiences that they're having in implementing the clinics, and identify training needs and other considerations to support the effective operation of the clinics. And then there's the local working groups, which I also mentioned earlier, which are another really important part of the governance arrangements, because that brings together the PPCC, the health service, the local ambulance Victoria rep, and the PHNs to really drill down into making it work at a local level and ensuring that there are appropriate referral pathways and those type of considerations. We also have a clinical reference group, which I've actually now, it's just completely escaped me the name of our chair, which is very embarrassing. So I'm going to have to come
Oakley?
back to that. Yes, I've got his first name. From the Royal Children's Hospital, but that group provides advice around the inclusions and exclusions, so and other advice to PPCCs around clinical aspects of the model from time to time when we get queries from PPCCs around particular clinical issues or considerations, and that can come to the clinical reference group for their consideration and response. I think that's probably all I have to say on the governance. So, so yeah, that's really just going to what I was just talking about, the role of the clinical reference group around the inclusion and exclusion criteria, referral protocols and pathways, and practice scope requirements, training and development. So it's an important part of the governance arrangement. So since the PPCC started progressively opening from September last year, they have been increasingly impactful, I suppose, in terms of throughput and the early data that we have around their impacts on ED presentations and those type of considerations. So to this point in time, over 68,000 patients have been seen at a priority primary care centre, which is a really good number. We have a patient survey as part of our data collection around PPCCs, and we know from that survey that just over 50% of patients would have attended an emergency department if the PPCC was not available. The presentation types are also listed on this slide, and we have other data as well that can show us what some of the like referral pathways are into the PPCC and out. So we're really pleased, I guess, that we've got a solid data and reporting framework that we can really utilise to help demonstrate the impact of this model. Next slide, please, Bianca. I won't go into this. This is just more detail around the inclusion and the exclusion criteria for PPCCs. So we might just skip over that, but that just, yeah, and that's the exclusion. I'm not sure, Bri, do we have that on our website? That might be available on our website. Yeah. If people want to look at that in more detail. And I think the last slide is the list of the PPCCs, and we've bolded the bolded centres are the ones that will be co-badged with the Commonwealth under this partnership with the Commonwealth. So that's the overview of the initiative. Hopefully that was helpful. Obviously, as Bianca said, happy to take any questions on that.
Thanks, Abby. I'm just going to introduce now Jack Williams from the Northwest Melbourne PHN, who's just going to talk a little bit more. You touched on it, Abby, so probably don't go into in too much detail, but the local working groups and their role.
Thanks, Bianca. So as Abby and Bianca have touched on already, the local working groups made up of the health service or the hospital, the PPCC, the PHN. We facilitate these meetings and we also get AV to them as well. So the main purpose of the meetings are to set up the referral pathways between the hospital and the PPCC. Probably the most important one is just that direct referral pathway either to the hospital or back to the PPCC, but we're starting to see some of our PPCCs refer directly into sort of fracture clinics, allied health, and it'll be different depending on which, what we find with the hospital. Another thing that we do is another thing that we do is we work through if there's been any inappropriate referrals from the PPCC to the hospital, so we can troubleshoot those. And it's just a really good chance for everyone to come together and just basically look how the relationship's working and how the flow of patients is going. So ideally, we start these off really regularly. So ideally, we'd like to get one started prior to the PPCC opening. And we generally start these meetings off as weekly when we probably need that support to be at its greatest, but then after that we push out to sort of fortnightly and monthly. Is there anything else you want to add to that, Bianca?
No, that's great. Thanks, Jack. And I guess just some key points for the Inner Melbourne PPCC, and you've probably seen this in the documents if you have downloaded them from Tenderlink. So this service is supporting the Royal Melbourne Hospital, as Abby said. The following postcodes are we're very much looking at area that's close to the Royal Melbourne in terms of proximity, but also, making sure that we're not putting a new site too close to an existing PPCC. That's why those sort of following postcodes have been chosen. The opening hours for this clinic will look a little bit different, and therefore the funding to sort of match that, but an expectation to open up to 14 hours a day, 7 days a week. And there is a contract for 6 months with likely extension for a further 2.5 years, dependent on funding. So similar to what Abby was saying, but just really wanted to make that clear that if anyone's been to other information sessions, there are a couple of differences with this particular tender. I will hand over now to Mel for just to talk us through a little bit about the tender process. So over to you, Mel.
Thanks, Bianca. Hi, everybody. Just a bit of a reminder that once the Zoom meeting obviously completes, that the links that have been put in the chat might disappear forever for a lot of you participating. So if you wanted to, while we're talking, copy that and paste it onto your browsers. I have just popped in the Tenderlink link. In order for those of you who might not have had a chance to access the tender website and register and download the documentation, you've got the link there that you can do so while we're talking. So I've got two sort of hats I'm wearing at the moment. So just to give you a bit of a probity update and a reminder. So please familiarize yourself with the procurement timelines. So the closing date and time for questions and proposals. So as you well know, we're using an e-procurement system at the moment. So we're not going via email or any other method of submission. So everything has to go through electronically via Tenderlink. So in doing that, please, consider providing detailed and specific answers to the questions rather than general statements, because the evaluation panel, we are bound by strict probity rules. So therefore, we can only evaluate what is actually written in your bid. So for example, a lot of you work quite closely with the PHN and obviously the department. Please don't assume that, currently what you're doing would be something that would take into consideration in our evaluation unless it's already actually quite explicitly written in your bid. Also, because we need to maintain the probity guidelines around here, we are not encouraging any communications or calls or emails or anything with the PHN regarding the procurement other than via the tender portal. So you'll see there's a forum in the tender portal that you can place information in terms of asking any questions that you might have. In saying that, please be mindful, the forum is a publicly available forum. Therefore, whatever you put in there, anybody who's registered for Tenderlink with access to it and the tender will be able to view it. So we kindly request that you do not put your personal details in there, names, or in particular, any commercially sensitive information like how you might want to be structuring your model or, and definitely not any sort of identifiable data that might breach confidentiality. And that will be helpful. So please phrase your clarification questions accordingly. And we at the PHN will do our best to be able to respond to your clarification questions within 24 hours where possible. And just a reminder, please allow plenty of time to upload your submission, because the submission is actually not a form that you fill out outside of Tenderlink. You actually have to fill the documentation within Tenderlink. So there are actually fields like you would do, filling out a form online. Allow enough time for that, because the tender portal will lock at sharp 12 o'clock and you will be locked out if you have an unfinished submission. And unfortunately, we won't be accepting late submissions in any other format. Thanks, Bianca. If you can move on to the next.
Yeah.
So it's a high-level timeline. Again, a lot of this information will already be quite clearly defined in the tender documentations that you will or may have already downloaded. So clearly, the tender went live on Monday. We've got the market briefing today, and we've given 4 weeks for providers to obviously download the tenders, determine if they want to apply, and start the application process. Keeping in mind, you can save and continue application process, so you don't have to do it all in one day. And we suggest that you please, quite clearly pay attention to the questions, because some questions actually have attachments that sections for attachments that you have to actually upload. And some of the attachments have been provided in the tender pack as well for copies if you wanted to view them offline. So we have clarification questions, like we said, via the forum. So those will be closing a few days before the tender closes. So that allows us to be able to give you the full information you need to be able to complete your tender submissions. And the tender will close on the 30th of June at 12 p.m. We know it's a very busy time of year for a lot of us and a lot of you. However, these are the timelines that we must keep to in order to be able to meet, all the required timelines and deadlines to set up the PPCC. We will hope that in July we'll continue with contract negotiation and finalizations, and the contracts of the services to be commencing in August. Like I said, I've put the link in the chat as well, so everybody's got something that they can click on and download as soon as they can. Bianca, next slide, please. So a little bit of information just in a different format for the same thing. So the Tenderlink forum will be closing for clarification questions at 3 p.m. on the 28th of May. And in order to not be locked out or submit, in order to have enough time to submit your application, we also encourage that you do that by 11:30 a.m. on the 30th of June before it closes at 12 p.m. And some of the things that you might not realize that might be an issue on the day would be, just normal server delays or, access or technical issues. So that's why we're encouraging that if you can submit your tender application sooner, that'll be great, just so that there's any unforeseen circumstances can be avoided. And in doing so, from a probity perspective, we cannot actually share information about applications due to the strict probity conditions. So as most of you have worked with us before in submitting applications, we tend to go into a bit of a cone of silence after the tender closes, because we are quite busy doing evaluations and getting the process progressing within those timelines. So I'll stop there, and if there's any particular questions, please ask. Otherwise, happy to hand the mic back to Bianca.
Thanks, Mel. And something that I should have said at the beginning, so we are recording this session. We do make it available via Tenderlink, I believe, Mel, through the system there, the forum.
Yep.
Yeah. So and also we have, as Mel said, any of the questions. So this will be uploaded on there. So if you need to watch it back, or anyone who wasn't able to attend is able to access. So I'm just going to stop screen sharing now and just open up if anyone has any questions that they'd like to ask. I can see, thanks, Bri, for putting the link to the inclusion exclusion criteria. And as you said, Mel, you've got the link to the Tenderlink system in there. But any questions that we have from anyone? Yes, Danal, got a question.
Hi everyone, my name is Dinal. I'm we currently part of the PPCC program. So thank you for everyone for making that possible. We're currently looking after the Marunda PPCC, and it is going very well. Consulted over 400 patients, or very nearly 400 patients last week. So been really, really busy. Just a quick question, just around the postcodes. We've got a respiratory clinic, which is currently due to finish in end of June in Ascot Vale, which is under about 4.8 kilometers from Royal Melbourne Hospital. So my question is, I mean, first question anyway, is if it is outside the said postcodes, is that an automatic disqualification for any clinic who's submitting, or would you consider otherwise?
I think, Mel, I can have a go at answering this, but let me know, or do you want to go?
Yeah, I'll go. I
Yeah,
was
go for it.
thinking maybe the department might jump in, but that's fine. I would say yes, there'll be an automatic disqualification. We've been quite clear in the fact that they must fall within those postcodes. So yeah, we wouldn't be able to, break sort of probity rules to be able to allow an outlier. We have to run an equal and competitive process. So therefore, if you don't fall under those postcodes or have availability of practices being able to deliver within that postcode, it'll be automatic disqualification. So I wouldn't encourage anybody putting in if they're not in that postcode. Actually, it's a lot of time and effort wasted.
I understand. That's why I thought I'll just clarify that. But thank you very much, Mel, for the clarification.
That's all right. Thanks, Dina.
Thanks.
No, perfect. That's why we're here, to answer those questions. So that's great. Thank you. Anything that anyone else wanted to ask? Richie, get a question?
Yeah, I do. So Richie from the Youth Projects Primary Health Service. So I'm just reading between the lines here that it's not to support existing practices of ours, which would suggest new premises need to be secured, and how that kind of aligns with a 6-month contract when you're entering into commercial contracts for properties, possibly. Is there any possibilities of letters of comfort or the like, or maybe just a little bit of background as why it's 6 months initially?
Yeah, I'll answer the first part of the question, and then I might hand over to sort of Abby for a bit more information about the 6 months. So in terms of the can't be used to support, you used the wording there that came directly from the thing, but support existing hours. So some of the clinics are operating 2 different services from the same premises. So their usual general practice that this funding can't be used for, and also priority primary care centre. So on the same premises, but often with separate entrances and specific dedicated part of the clinic put aside for that. So there's not a requirement necessarily. Certainly with the 6 month, as you say, time is a bit of the essence in sort of getting services up and running. So we would we've sort of talked about having clinics that are working currently operating from those postcodes to sort of reduce any delays that we might have from extensive infrastructure changes and that sort of thing. So, but we are having clinics currently that are PPCCs that are running both services across, but this funding would obviously only be used to support the functioning of the priority primary care centre for those extended hours. Abby, do you want to take the question around the 6 months?
Yes.
Putting you on the spot.
Yes. So the 6 months, I guess we're trying to, as much as possible, align the Commonwealth co-badged clinics with our existing PPCCs in Victoria. And I'm talking about that in a number of senses. So, for example, when we want the kind of comms and branding to be consistent. So from a public perspective, it makes absolutely no difference whether you're going to a purely state-funded PPCC or a co-badged PPCC. So we want the requirements to be the same, and so as much as possible, basically, we're looking to try and be consistent across the existing state-funded PPCCs and the PPCCs that will be co-badged with the Commonwealth, including this one. So on that, the current PPCCs in Victoria that have been funded by the state government, their contracts go through for another 6 months to the end of the year. There is funding in the state budget to extend those contracts, and we obviously now have the Commonwealth funding as well. So what we'll be doing is working through what the arrangements are going to look like beyond the end of that 6 months for all of the PPCCs, both the state funded and the co-badged clinics, obviously with that principle that, you know, we want consistency across and an equitable approach across all of our PPCCs. So we weren't in a position at this stage to be able to kind of settle what those arrangements are beyond the 6 months, which is why we've why it's an initial 6 months until we have some more clarity around what the arrangements will be beyond that, noting that we do want that consistency across all the clinics. So hopefully that adequately answers your question.
Yep, thank you. It does on both counts.
Thanks, Abby. Put you in the hot seat there. Thanks for the question, Richie. I think it's Zelin. Got a question from you? Zelin Huang. Not sure if you can come off mute. I can see your hand up.
Hi, I think it's signed with the wrong profile. My name's Achille, sorry.
Oh, sorry, no problem.
Yeah.
Apologies.
I just got a question. So is it automatic disqualification if your primary clinic is not in the same PHN?
The probably answer to that is yes, because
Yes.
the postcodes are within this PHN.
Yeah, okay.
So it's yeah.
And what's the key difference between, I guess, the ones that are Commonwealth funded and the state funded ones? Like, is there meant to be a different level of service that you're meant to provide, or is there extra funding for the Commonwealth ones, or is it literally the same service?
So, Abby, you've just come off mute.
Yeah, I mean, I think that kind of goes to what I was just saying in response to the other question. As much as possible, we want them to be the same. So the you know, the requirements, the service requirements will be the same. We're looking to have consistent funding arrangements. So we're hoping that the branding will be, you know, the same.
Yeah.
Data and reporting, that's another complicated one that we're working through with the Commonwealth at the moment, but we already, you know, have an existing data and reporting framework, and we're hoping that, you know, the co-badged Commonwealth clinics can, you know, be integrated into that, so that as much as possible, you know, we can make this a seamless arrangement.
Cool. All right. And then with the inappropriate referrals, is that something that Melbourne Health will give a list and say, these are the things that we don't want you to send to us, and these are things that we're happy for you to send to us? Or is it more kind of like a retrospective thing?
No, so it's a really good question. So I think with the local working groups, there's the inclusion and exclusion criteria that everyone's very aware of, both from the clinic and the local health service. And when we say the inappropriate referrals, is probably more about just establishing those pathways. So they're a real opportunity to come together for all the clinicians kind of involved to say, oh, there's someone that came, you sent them from ED, you know, this is why we didn't think they're appropriate, and that's why we sent them back. But it's an opportunity to really look at further establishing those pathways, and those cases of inappropriate or potentially not sure if I could send them, that you would be able to manage them. Conversations are really good to start to build those pathways and be really clear around, and also build the trust, I think, between the health service and the clinics, because often it's really important to have the hospitals engaged in these conversations really early, so they can start to build the trust and understand the capability of the PPCCs, which are you know, takes a little bit of work. So those discussions around generally happen in as real time as possible, but at those local working groups that, as Jack said, start sort of quite frequently, very much when we're starting and sort of working out opening hours, that sort of thing.
Sure. Okay.
Yeah.
And last question, in terms of like pathology and access to imaging, is that something that will still need to be done external to Melbourne Health, or is it something that we have access to, like after hours?
Look, I think the best way to answer that is ideally, best case scenario, that's on site at the PPCC. As Abby said, that's often, there's difficulties in that, and so close to the clinic as possible. Ideally, we're not reliant on the hospital for their services because we're really trying to keep people out of hospital.
Okay.
So we'd be looking at sort of pathways that potentially, if there's no availability on site, established with local sort of providers that might be able to potentially extend hours or open on weekends or that kind of thing. But ideally trying to avoid people needing to go back to the health service if at all possible.
Okay, so it's not like the RCH or the Monash Children's one. It's like the other regular PPCCs.
Yeah, absolutely. So it's there's not a requirement that this is co-located like it was at the Children's, for example.
That's all. Thank you so much for answering my questions.
No problem. Richie, you've got another question?
Sorry, me again.
Yeah.
Might just need to point me to where I can find this in the documentation, but just in terms of the establishment grants, just maybe just outline what they can be used for, particularly if they can be used for capital works to create separate spaces.
Yeah, I think I can't think exactly where it is in the document, but I think it talks about being able to be used for, I think it might say minor capital works. So again, just in terms of the timeframes of these clinics, and probably that we wouldn't be expecting a brand new clinic to be built. I'm not suggesting that's what you're saying, but I think it's about those establishment in terms of recruitment for starting to get to workforce, which we know that it's difficult. The equipment, so the clinical reference group, as Abby mentioned, has a sort of equipment list, a medication list. So there might be things for fracture management or stuff that currently isn't stocked in the clinic that you could be purchasing as part of that establishment fund. So I think it sort of minor capital works, but understanding that potentially to be able to enable, consulting rooms, treatment rooms, etc., you might need to move a wall or whatever that is. But I'd be suggesting to sort of detail those sort of things. There's sections within the document that talks about the infrastructure available, etc. So anything that was needed above that you would be thinking, I'd be certainly encouraging people to put in as part of their application and have that considered.
Brilliant. Thank you.
Excellent. Any other questions? Yes. Pankaj?
That's right. Hi, my name is Pankaj, and I have a question regarding the telehealth service that's been included as part of the scope, which was listed earlier. So my question is, so would you expect responses from telehealth service providers directly, or would that be something that you would expect to be coordinated with the PCC provider as a one integrated solution?
Yeah, so sorry, just is your question about could a purely telehealth only provider apply?
Respond in terms of a telehealth service for this part of.
So I would be, so for the PPCC, absolutely they exist to be able to take pressure off the hospital system and be able to see those patients face to face. So these are patients that are potentially have a laceration that needs suturing, fractures we're seeing come through, etc. So that face-to-face assessment is really important. There is capability within the models to have telehealth delivered, but as part of follow-up, that would be for a follow-up of a patient's results who may have come in, or checking how they're going the next day, but it wouldn't be the primary service. So the primary service still needs to be face-to-face delivery.
Okay, sure.
If
that's
that,
fine. Yeah, no, absolutely. That clarifies it. Thank you.
Excellent, no problem. Any other questions? So while people might be trying to find their hand up button, just to say, as Mel sort of said several times, this isn't the only time. So we do have questions open until the 28th of June. Obviously, the sooner they get in, the better, because the longer you've got time to sort of think about your application, etc. But if anything else comes to mind, please make sure you register with Tenderlink, and you can submit those questions through the Tenderlink forum. And as Mel said, we'll endeavour to turn those questions around. And any question, as Mel said, is publicly available, so everyone will see those questions and responses. And please, just a reminder, just in terms of don't, be offended if you reach out to the PHN and we're unable to help you. We will be directing people to the Tenderlink portal. So yeah, just be mindful of that. But if there are no other questions, thank you so much, Abby and Bri, for joining us. Thank you all for your interest, and apologies, we're a little bit late starting, but we're a little bit early finishing, so always a bonus. Thank you very much.
Thanks
all.
all. Thanks, Bianca.